My name is Rebecca Mazer. I am the Senior Manager for the Academic and Relations team. We are actually part of the Talent Acquisition team, so I work really closely with Ryan. We do a lot of the events, lunch and learns and socials, and we meet a lot of the students, and we work hand in hand with the dental schools to get you guys to, meet some of our owners and interview, and we introduce you guys to the recruiters. So it's an awesome job. I love my job. And again, I work alongside Ryan on helping educate a lot of our dental students on Aspen Dental, what we have to offer. So we have a fun 1 hour Ask Me Anything session with our two doctors. We have quite a few questions that have been submitted already from our attendees. And if you guys want to pose any questions live, you're welcome to. There's a little link right at the bottom. It's a QA box. If you guys have any questions, you can pop those in there. They'll show up on my end and I can pose those directly to the doctors, okay? So I'm going to let you guys introduce yourselves and then we'll get started with our questions. So Dr. Vi, I'll let you start first and then we'll go to Dr. Smith and then Ryan. So Dr. Vi, go for it.
I'm Dr. Vi. I work in Greenville, Tennessee, and I graduated in 2019 from Meharry.
Awesome. And you are what's your current role?
Managing clinical director. I currently run an office as the only doctor.
Okay, love it. And for those that don't know, a managing clinical director is very, very much a lead dentist in the office. Okay, and Aspen does have tons of acronyms, so if there's anything that we say, MCD or any other role that you don't understand, pop a question in and we'll help clear that up for you guys. Dr. Smith?
Sure, so I'm Dr. Smith. I currently work in two offices, Nashville, Tennessee, and then my home office, which is in Columbia, Tennessee. I'm an associate dentist, but I was an MCD for the past 5 months. As my current MCD was on maternity leave, so I kind of took over that position. But now I'm back in the associate role.
Wonderful. So you've kind of played both parts, so you can answer some questions on both ends.
Yep.
Love that. Okay, Ryan.
And I am Ryan King. So I am the doctor recruiter for the state of Tennessee. Obviously, not everyone who goes to Meharry is necessarily looking to stay in Tennessee, so I can help that process facilitate to any state that you're looking to go to. I've been with Aspen a little over 3 years.
Awesome. All right, guys. So again, thank you for those that have signed in. We have a 1 hour Ask Me Anything session, and if you guys have any questions, as we're having a conversation, please ask. This is going to be super conversational, guys. Very informative, very fun, very lighthearted. So I want to say nothing's off the table. So please be honest and talk to us about your guys' experience with Aspen. So let's get started. We'll start with our first question that popped up. So the first question is, what options did you look into coming out of dental school? And why did you end up choosing Aspen? So Dr. Vi, I'll start with you.
Okay. I knew I wanted to work for a DSO. I didn't want to manage the promotional aspect, the legal aspects of running a practice. I just wanted to go in, do what I needed to do, and go home at the end of the day. And Aspen is a really good DSO. It's one of the biggest and has a huge network that I really liked. And they encourage their dentists, revolve the practice around the dentist, supporting the dentist. Not as much with the other DSOs that I looked into. So Aspen is more dentist focused on getting us what we need than some of the other places that I was interviewing for.
Okay, love it. Dr. Smith, I'm going to ask you that question here as well, but really quick, Ryan, do you want to just touch on what a DSO is and what Aspen does in respect to a DSO? ADM.
So DSO is a dental service organization, and you guys might have probably have heard of Heartland or Pacific or any other one of those big name DSOs. So Aspen is the biggest branded practice. So basically what that means is all of our practices are owned by dentists, but they're all branded the same. So you could go into an office in Texas and you could go into an office in Tennessee. Some of the operations that take place in that practice might differ from one another. There could be small differences in equipment in one or the other. Because they are individually owned, but they're branded the same. And so basically, like Dr. Vi was saying, that she wanted to come to Aspen and wanted to go work somewhere where she felt like she could just focus on dentistry. So that's where that model comes in, is Aspen. It's ADMI, Aspen Dental Management Inc. Is kind of the business arm of things. So in those practices, they're the ones helping to run everything non-clinical, so that literally our dentists can just come to work, focus on dentistry, focus on morale in their office, but not have to worry about some of the other parts, marketing, recruiting, finding dental hygienists and assistants. We all kind of take care of that. So it's truly just a way for dentists to come in and focus strictly on dentistry.
Absolutely. Thank you, Ryan. I appreciate you answering that. Dr. Smith, really quick, I want you to answer that question as well. So what options did you look into coming out of dental school, and why did you choose Aspen over those?
Yeah, so I mean, I definitely, Ryan definitely knows a little bit because he was instrumental in getting me in. But I was kind of going back and forth between private practice and, working for corporate. But honestly, in the end, corporate was just kind of like what Dr. Vive said. It was so much better. Especially with things like coronavirus going on, stability is a huge thing. With private practice, oftentimes you're dealing with one sole person, that owner. And, coming in as an associate doctor, it's pretty much everything trickles through one person. But with a large corporation like Aspen, you have a lot more opportunity to develop yourself the way that you want to develop. I mean, there's just so many options in terms of being able to treatment plan the way you want to, being able to handle the cases that you feel comfortable handling, and also even, the opportunity to experiment with different dental materials. If you just find, a composite that you feel like you want to try, it's definitely an avenue that, you can experience a lot more of being at a place like Aspen versus, like a private practice.
Love that. Awesome. So we just had a question that popped up live. This one's referring to you, Dr. Vi. The question is, how was transitioning from a dental school student to being the head dentist without an older dentist to help you?
So I started as an associate in a very busy office. The head dentist there was very hands-off. He didn't really get his hands dirty with anything. So if something needed to be done, I had to do it. So it was more like, it was a really quick learning experience. When an opportunity came up during the coronavirus to move to another practice and to run it myself, I felt very prepared because I had been working in a very busy office, keeping a busy schedule and being able to handle everything. So every office is different. My MCD for me, because if I really needed help, he was there, but he was more hands-off, let you figure it out, and then I'll jump in if I feel like there's something that I need to help you with. That learning style works best for me. If you want someone more hands-on, let your interviewer know that and get someone more hands-on, but that's not something I wanted.
Oh, wow. Okay. So you wanted to take it on yourself. So having someone to kind of hover over you and help you wasn't your style.
Well, I wanted someone there just in case something happened, but I was very happy with being thrown into a busy office and having to figure things out myself. But in case something happened, I needed somebody there. But right now, I just prefer. So.
Okay. Yeah, that's cool. Dr. Smith, did you have that same experience? Or did you prefer having someone a little bit more hands-on with you?
I didn't necessarily need someone hands-on, but there was someone there, I need anything.
Right.
My experience was, Aspen has, because I actually went in straight out of school, so no residency or anything. And it was just a matter of taking those same school experiences and transferring it to practice. But Aspen was really good because they had, kind of an orientation set up. So it wasn't just like you were literally thrown in and oh my gosh, you have to do full mouth, extractions in, I don't know, an hour. They work you up to whatever it is you're comfortable with. So, you never have to feel like you're in it alone. There's always going to be, someone to help you, even if it means, you might not need to do a procedure that day. You might need to, conference with someone, then that's totally available. I mean, you should never feel like you're just, swimming in deep water. So I've never felt.
Good. So you always felt supported, even when you felt like you didn't really need the help.
Yeah.
Okay, awesome. We have another question that has popped up here. So what advice would you give a dental student to be prepared coming out of dental school?
Oh, yeah.
What advice would you give your D4 self? Dr. Vi, we'll start with you.
Pay attention to Dr. Tias, because a lot of the times where I don't know what I'm doing, I just think straight to Dr. Tias. Our lab tech broke his hand, so we've been without a lab tech for a couple weeks. We're getting another one, but he's training, so we'll get him in a week. But there's been some procedures that I didn't want to, like building wax bites and pouring in compressions, that you can't just ship off and get done. It's more cost effective to just do them yourself. So remember your lab work, do it yourself. Remember Dr. Tias and Dr. Perkins, all those people who got really annoying during dental school. Like, you really think back and try to remember what they said. When you're knee deep in an extraction, you're going to want to hear Perkins yelling in your ear what to do next, like in your head. So.
I love that. That's some great advice. All right, Dr. Smith, what would you tell your D4 self?
Angela, Dr. Vi, she hit it on the head there. Definitely, Dr. Tias is a wealth of information, and, a lot of people might find him long-winded, but the meat of what he has to say is so important for just practice in general. I would also say, pay attention in clinic. They know what I'm talking about. Do the procedures the right way. Don't try to cut any corners, because the thing is, when you get out there in the real world, like, everything is on you. No one is checking you. So take those lessons seriously when you're in clinic, like learning how to, check for decay, making sure your margins are good in your crowns, just doing fillings correct. Like, that whole thing is vitally important, because the thing is, when you get out, no one is going to check you. Likewise, oral surgery. I don't want to say that if I was in your position as a D4, I'd probably try to spend as much time in oral surgery as possible, because there are still so many lessons that I wish I would have picked up in oral surgery, like learning how to do like different types of sutures. I only learned one type in oral surgery, and that's the only thing I use right now. But there's just so many lessons, especially the medically compromised patient. I know some of you guys probably, hate having to prepare for like oral surgery rounds first thing, at like 7 a.m. in the morning, whenever that is. But that's important, because you'll realize that as the doctor, you're the only one who has any sort of knowledge about, what contraindications are, because you have to write medical releases yourself and communicate with a doctor using right terminology. Same thing with oral pathology and radiology. Like, you're the one who has to diagnose things. So all of that stuff that they're talking to you about in class, we in the class of 2019, we share pictures all the time of different cases. And some of that stuff is the same things that you're seeing on slides in class. So you really do have to pay attention, and, you should be fine.
So moral of the story is pay attention in class. Yeah. Okay.
Yeah.
That's awesome. Okay, thanks, guys. Now, a residency question. Should I go into residency? Did you feel like Aspen gave you enough support to not go into residency and go straight to work? Dr. Vaught, go for it.
So Aspen has a month training where you go in knowing nothing. Well, okay, you go in knowing what you learned out of dental school, which is nothing, by the way. And then you observe, and you gradually observe more and more people. And then you slowly get a couple patients. And then after the month, you'll get your own schedule. They're not going to throw you in and make you do a whole bunch of stuff in a short amount of time. You tell them exactly how much time you need for every procedure. There's a huge packet. You have to fill out exactly what you want for every procedure, how much time you need, what you want the assistant to do. There's a big old packet that you have to fill out with everything you want. And if it changes, you just print out another packet, fill it out. But no one's going to make you do a procedure in less time than you want to. If you see it on the schedule the day before, say, hey, extend this out, kick the next patient off, and they do it. They're not going to force you to do things in a quicker time than you want because they don't want to deal with the liability if you mess up. So.
Good call. Dr. Smith, do you want to add anything to that?
Yeah, so in terms of deciding, the question was deciding whether or not to do residency or go straight out.
Should I go into residency? Did you feel like Aspen gave you enough support do you feel like Aspen gave you enough support not going into residency and going straight to work?
Oh yeah, so I mean, this question is pretty easy for me, and it kind of goes back to that whole preparation step in dental school. You felt like, you know, there were things that you were like truly uncomfortable with and really didn't know. You know, it really just depends because each student is different. You know, I tried to take advantage of almost everything, you know, trying to do over the maximum amount of requirements because I knew that I wanted to go to work. So I kind of knew that I had to be prepared. But kind of like Dr. Vi said, Aspen has that orientation where you have time to, you know, it's kind of like a self-reflection period as well. So you can kind of figure out your strengths and weaknesses. And, you know, if there are things that you don't feel comfortable with doing, then, you know, you don't have to do them. For instance, my office, they weren't doing root canals because the doctors there just stopped doing root canals for whatever reason. And so, you know, I was fresh out of school. I did over the requirement of root canals in school. So I said, hey, I'm going to do root canals. And so, you know, I've automatically, you know, kind of offered that to both of the practices. Do I do molar endo? No, because that just takes too much time. But everything else I'll do. So it just really depends upon your comfort level. But yes, I did feel prepared. Yes, even though I am prepared, there's still, you know, kind of questions I have every day. But, you know, the good thing is we have other doctors that we can communicate with as well.
Awesome. Ryan, let me ask you this question. What does the training look like for a new doctor that's coming in?
Yeah, so it's Dr. Vi touched on it a little bit, but it's basically a 4-week mentorship program. So when you get started, they'll partner you with a specific mentor doctor that's kind of like your buddy during that time in those 4 weeks. So, you know, first week might be non-clinical, just kind of making sure you're comfortable with where everything is in the office, new patient flow, how everything works, and kind of like she mentioned, weeks 2 through 4, it's hands-on. You're watching your mentor do procedures. They're watching you do procedures. They're identifying strengths. They're identifying areas for improvement. They're working with you on those things. You're learning how long each procedure takes. So that way, when they build your schedule out for you, it's an accurate representation of your skill set and not, I think I get this question a lot when I talk to new grads is like, a lot of them are worried about scheduling and like, well, how does it work? You know, is there a certain amount of times I have to do these procedures in? We build those schedules around the skill set that you have. And we try to help you develop to have a better skill set over time. But, you know, as the question, like, do you go into residency or not? I mean, I think each person has their own answer and there's not a correct answer. Some people might go into residency out of a fear of like just not feeling prepared. And I think we do a really good job of making sure during that time that like, it's okay to not feel prepared on day 1, because by day 31 or day 60, you're going to be ready. And sometimes that 4-week mentorship program, there's been people it's taken longer for, and that's not a big deal. You know, if they're not necessarily ready yet, we can work through that too. You know, there's still residency programs that are perfect for people, and, you know, it's good decisions for some people, but for the people that maybe are doing it just because they don't feel ready yet, I think our mentorship program really helps with that.
Absolutely. I agree. And I'm glad you touched on that, because I mean, I have a lot of new grads that have started that have said, a friend of mine went to residency, I went straight to Aspen, and we compare notes all the time. And I feel like I've learned more, or I'm doing more than, you know, he or she is. So you guys are probably seeing just as many cases and doing just as much as someone that would be in residency within your first couple weeks. I mean, that's just kind of the feedback that I've gotten. A question just popped up. Ryan, did you want to answer this one?
Yeah, I'll take it. So,
Okay, so the question is, how does Aspen Dental handle new grads who are not yet licensed?
yeah, so I think we just hired our first 2021 grad, or I hired my first 2021 grad in Kentucky. And so they obviously don't have their license yet. They're not done with school. So obviously, like, the offer's kind of contingent that you will eventually get your license. But most people, when they finish school, then they have their diploma, they apply for their licensure, and we just kind of wait to make your start date around when you have your license and you're through credentialing on our end. So we totally understand you won't have it, and we still kind of talk about moving forward and go ahead and even extend offers for you to sign. And then, the last step is basically you just getting your license after graduation.
Absolutely. So like Ryan said, guys, for our D4s that are out there, we're signing quite a few D4s now. I mean, it's never too early to start shadowing and looking at opportunities. So if you guys are interested in learning more, please don't hesitate to reach out to Ryan or to myself. We'll steer you in the right direction and make sure that you have all your questions answered. All right, awesome. Again, guys, keep those live questions coming. If you have anything that pops into mind while our docs are answering questions, you can pop that in and we'll answer that for you guys live. All right, so we have, go ahead, Dr. Smith.
And on that one, yeah, because I basically, to go off what Ryan said, I think I interviewed like January 2019. And so we already had an offer by February, and, that was it. So it was nice because, everything was pretty much final. And, they just kept in contact with me periodically. What was really nice too is they even kind of checked in when I was taking my licensure and just like wishing me luck. And so that was cool because I kind of forgot about it. And it was like, oh, hey, good luck, Dr. Smith. I was like, oh, I'm not even a doctor yet. So, little things like that really helped, motivate me to keep going. But, I didn't have to worry about any of that. They'll, just get your stuff done and they'll be there for you.
Absolutely. We have a solid credentialing team that'll walk you through the process. So that's a great little story, Dr. Smith. Okay, so another question just popped up. I know we talked a little bit about treatment planning. So this question's asking, do you do your own treatment plans? Do you get to do procedures you want, or does the lead doctor get all the procedures? So, I mean, that's a great question specifically for folks that are in private practice that have, a lead dentist that's probably taking the more difficult procedures or the more profitable procedures. When you guys started, did you guys get to do your own treatment planning, or what did that look like? So, Dr. Guy, you want to start?
Yeah, for me, I did. So if you want to see a new patient, you see the new patient, you do the treatment plan. Or what I did is I had my treatment plan together before I went into the patient. I looked at the x-rays and I talked to the lead doc, and I asked him what he thought. Is there anything I missed? Usually he's like, go ahead, you can't screw up a treatment plan. And so I would go ahead, and if there's anything I missed, he would say, oh, well, look, there's a cavity here. Someone else does a treatment plan. So a lot of doctors can work in different offices. Matt works in 2 offices. There's probably other doctors rotating, other people doing treatment plans. If someone does a treatment plan that you do not agree with, like if your lead doc says this is what the patient needs, it's your license. You're the one doing the work. So if you don't think that tooth needs a filling, you think it needs a crown, you tell the patient, okay, I know that doctor said this, but this is why I would like to do a crown. So we'll bring you to the front. They'll talk to you about the price of a crown. If that's something you want to do, we'll go ahead and start that for you, or we'll reschedule you or anything like that. You do not have to do anything that someone else planned that you don't want to do. If there's someone planned a root canal, you're filling in that day, you do not want to do a root canal, you tell them, hey, get this root canal off the schedule. I'm not doing it. It's all about you. It's your license. If you lose your license, Aspen they don't benefit from that. They have to find another doctor. They have to help you with your lawsuit. They're just going to do what you want to do.
Right. I love that. Dr. Smith, like you said, when you first started, people weren't doing root canals, right? But you felt comfortable doing them. So you said, I'm going to jump on in there and do root canals. Were you right away doing your own treatment planning, or were you working off your mentor's treatment plan for a little while? What was your experience like?
Yeah, so the way they started, kind of similar, like Ryan was talking about with the orientation. So part of the thing is, you just don't get thrown in. So at first I was, I would say, going off of the other person's treatment plan because I was only like working on production. So like just doing procedures. And I did that for about a week. But like Dr. Vi said, if there was something that I was like, hey, I think this is a MOD instead of a, DO, I could very well just change it. There were no sort of issues like that. There's no like, oh, this person has to do a bigger case because they're the lead. We treatment plan whatever we need, and whoever schedule it's on is who does it. I mean, it's just that easy. Because the way that the overall payment is even structured, it's not based on what doctor does a specific procedure anyway. So none of that really matters at all. But we have total autonomy about that. I mean, as a matter of fact, today a doctor planned a crown, and I was like, no, that just needs a DO, and so we changed it. It was that simple.
Awesome. All right, so we have a question that just populated live. Ryan, I'm gonna have you answer this one. Are dentists paid off production or are they salaried? So can you kind of our structure a little, just really quick?
Yeah, so our dentists are paid off a percentage of the gross profit of the entire practice. So I'll try to make this as simple as possible because it is a little bulky. But to answer your question in short, all of our doctors have a guaranteed daily rate. So your daily rate is something that you're going to get every single day, no matter what. Generally speaking, it's anywhere from $550 to $650 a day. There's some cases that could be more, there's some cases that could be less, but just speaking averages, that's about where you're at. So let's say you worked 20 days in a month. That would be a guaranteed $12,000. So, but you're paid off a percentage of the gross profit of the practice. So where that would differ from, for instance, private practice. If you go into private practice, you might make 30% of your own collections. So everything's on you. So our model is off of the entire office's production. So for instance, Dr. Smith, the associate in Nashville West, and then there's a lead dentist there. It would be his production, her production, hygiene production, any surgeries that are done there. So if the guaranteed daily rate's there in one bucket, but if you make more from what you make your profit sharing, you get the difference between those two numbers, but you'll never make less than your daily rate. So your daily rate's guaranteed forever. There's no going in the negative and owing money at the end of the month. If it's a poor month, no matter what, you can count on X, and then whatever is above that, you get in addition to it.
Awesome. So to try to simplify that, Ryan.
That would be nice.
You have a daily guarantee, guys. That's never going to go away. And then we have kind of an incentive that's based off the production of the whole office. You're going to get the greater of the two. So if your office produces tons that month, you're going to and you're going to get 8 to 10%, or depending on your position. You're never going to get less than your daily guarantee, or you're going to get the greater amount of the two. So our doctors do very well. Like you said, a lot of private practices, DSOs have a very different pay structure. The last DSO I worked at, you got paid 30% of your production. Now, how much are you producing as an associate, as a new grad? Let's be honest, let's be real. How many actual procedures were you doing? And out of that, you're getting paid 30%. So a lot of, the new doctors that were coming in are like, I'm not making very much money. Everything's based off your own skill set, your own two hands. Whereas at Aspen, it's kind of a honeypot. It's a production of the whole office, and it's a team effort. So that kind of keeps everyone working as a team.
And one more thing, part of what that profit sharing model does is it fosters an environment in the practice where it is in the lead dentist's best interest to make sure that the associate is competent with their skill set and improving their skill set, because they benefit if their associate does more procedures. There can be awesome partners you could work with in a private practice where you get to learn a ton. It's not to say that there isn't, but if you work in a model where you're paid based off your own production and you have someone else that's more senior in your practice, it's in their best interest to take those bigger procedures. And at Aspen, it's not in the lead dentist's best interest. It's in their best interest for both of the doctors to be competent and to be able to do those procedures. And that's intentional too, because we want to make sure we have an environment that if a new grad comes in, they're going to get to learn, they're going to get to do procedures that they might get to do in private practice, but maybe not at the volume that they're going to get to do at Aspen because of the way that our profit model works.
Right. Absolutely. Awesome. So you guys, if there's any questions behind that, I know it's a little tricky because it's a very different model. Please don't hesitate to reach out to us. We can kind of go into a little bit more in depth.
I can also, if anybody does follow up, like I can send a spreadsheet that will make it
Absolutely.
a lot
We'll
easier.
break it down for you guys. All right, cool. So here's a question that popped up geographically. So it's asking, geographically speaking, did you guys wind up working somewhere that you wanted, or did you have to move? I'll have you docs answer that, and then Ryan, we can talk a little bit about locations and what that looks like. Dr. Vi.
So I only had a couple specifications. I wanted to work in Tennessee because of the taxes and the weather. And I also wanted somewhere rural where I can get a big house for not in the middle of the city. I wanted more land than I did people around me. There were a few areas in Tennessee that I interviewed in. I clicked very well with my current POP, which is owner doctor, and I decided to come to his region. I started in one office. When Corona hit, I got moved to another office about 45 minutes away. The drive is fine, but I recently moved out there. It's basically, if you're needed somewhere and you want to go, you can go. If you're needed somewhere and you don't want to go, you don't have to go. You go where you want to go. I like moving around, so for me that was fine as long as I can drive there within a reasonable amount of time. I don't mind it, but they're not going to send you somewhere and make you go there or you lose your job. That's ridiculous.
So you work where you want. You ended up where you wanted to be.
Yeah.
Awesome. Dr. Smith, did you end up in the location you wanted? How did that work out for you?
Yeah, so when I was hired, I stay here in Nashville. So just for starters, those of you who want to visit, feel free. They'll set you up with that. But I have a house here in Nashville. I'm married, so we've been here for 5 years, so we weren't really moving. But as far as like my practice location, originally where the opening is in Columbia, Tennessee. So some of you guys probably rotate out there for like Maury County, like dental rotations. So I'm out there, which is like south of Franklin. So from my house here in Nashville, I live like right by the stadium. It's about a 50-minute drive. So I've been doing that for a little bit of time now, almost a year. But likewise, my owner also owns the office that's in Nashville at the Nashville West Shopping Center. And there came an opportunity for me to work there as well. And that's like 12 minutes from my house. So that was great. So I've actually was able to split my time between both offices. So, that's just been really convenient for me, only because, Columbia, Tennessee, just given their population and their patient base, we do a lot more surgeries, a lot more extractions and denture delivery versus Nashville. We're doing a lot more, restorative, crown and bridge, and then even now we're doing Invisalign. So I kind of have the best of both worlds.
Awesome. Ryan, do you want to touch on that? If a student's interested in a specific location, or what it's like when the interview process starts?
Yeah, it's kind of so when we first talk, I'll ask like what your preferred location is. And so, a lot of people in Meharry, they'll want to stay in Nashville, which is, normal. There's not always openings where you want to be. So you could reach out to me and I could say, hey, we have Madison, Tennessee, which is 15 minutes away and it's open. But there could be a situation where you want to be in Nashville and the closest office that we have is 50 minutes or 55 minutes, like in Dr. Smith's case. I knew he wanted to be in Nashville, but Columbia was the closest that we could get. Generally speaking, in major markets, so bigger cities, Dallas, Atlanta, Nashville, Chicago, there's more opportunities if you're open to going further out. That doesn't mean that there isn't going to be an opportunity in the city that you want to be. But it's just kind of depends on the landscape and if there's a need in that market at that time. So I usually ask, the first question is what location do you want to be in? And then the second question is like, how comfortable would you be with a commute and up to what distance? And usually just kind of get a radius, and I let that person know when we have something that's in that, time frame that they're looking for. But it's kind of, you could reach out to me in 2 months and I could have 5 openings in Nashville, and then you could reach out to me in 4 months and there aren't any more in Nashville, and the closest thing we have is an hour away.
Right. So D4s, metro areas fill up fast, right? They're sexy, they're, urban. A lot of people want to be in the city. But then we have folks like Dr. Vi that's like, get me the heck out of the city. I want to be as far away as possible. So it's really, it really depends on where you want to be. But if you are one of those folks that do want to be in Nashville or in Chicago, it's in your best interest to start, reaching out now, because those places fill up really fast. And we have a huge candidate pool for like that. If you're open to going further out or going anywhere, the opportunities are a little bit more endless, and there's a lot, there's just a lot more out there. So if you guys are open to getting out of those, those major cities, the better. So,
yeah.
Those D4s, definitely reach out if you do want to be in a city that we know is going to be a little bit congested.
Yeah. I was just going to say, like, generally speaking, our offices that are further away from major cities tend to be our more productive offices. Just because, like Dr. Smith was saying, there's procedures he's going to be doing in Columbia that, like, just the clientele might not be happening in Nashville. Some offices there's not many in Tennessee. I'll just start with that, but there are locations, like the more rural the location, generally speaking, the more room there is to negotiate as far as your offers go, and maybe to get something additional to what your normal, a standard offer might be, because those areas are harder to recruit and the practice owners know that they might have to be a little more loose with what they agree upon. So, if like you're even partly considering like, hey, I'd be open to moving somewhere else. The office that Dr. Vise was in when she started in Morristown, it's like, they're packed to the gills. It's a super crowded office in the sense that, like, they generally do more than any other office in the state. And they're seeing the most new patients usually in the state. And so there's more financial opportunity in a location like that than there might be somewhere closer to a major city.
Absolutely. So guys, the opportunities are endless if you are a little bit lenient and open to going to places and being in the city. So awesome. So a question that just popped up as well, guys, does Aspen hire specialists for the offices? Yes, we do. Ryan, quickly answer that, and then I'll have the docs touch on and whether or not you guys have a specialist in your office.
We do. So generally speaking, like let's say you're an endodontist, you would like work. So Dr. Vi, the practices she's in is owned by Dr. Notoriani. So he has the majority of the practices in the Knoxville market. So he would have a specialist that would basically, you would know, she knows in Greenville, the specialist will be here on Tuesday, the 17th. So you start to refer, anything that the specialist needs to do to that person. And then those specialists are employed by Aspen. So they work for Aspen, but their schedule's a little bit more flexible than, the general dentist. Pays set up completely different, but we definitely do hire specialists. We have them in most every market. What
specialty do we hire, Ryan?
Endodontist, not ortho. So I don't particularly recruit specialty. So Dr. Smith or Dr. Vi maybe hop in here and help me out a little bit.
We do oral surgery as well, right, guys?
Yeah, it's typically just oral surgery and endo.
Do either of you two have an endo or an oral surgeon that comes in to help and rotate?
I have an oral surgeon.
Yeah,
and so they come in like once a month maybe, or?
He just started, so we don't have his schedule yet, but we're trying to get him twice a month. Our office is mainly extraction and dentures, so we're gonna need him twice a month to help out with the caseload.
Awesome. And then Dr. Smith, do you have an endo and a oral surgeon, or one or the other?
So we actually have both. Our oral surgeon has been there a while. They come once a month. So actually his next time is this Friday. So we pretty much, try to load their schedule with whatever cases that either we don't want to do or, can't do. For instance, impacted wisdom teeth, no need to get into that. So just put that on his schedule. Likewise, the same thing with, insanely like medically compromised patients, put those on his schedule. He'll, sedate them, pull the teeth, and deliver dentures. And then I think we just hired an endodontist. So once we build that load, then he'll start, kind of basing his schedule off of that. But yeah, so that way, we won't have to refer out, for instance, like all of our molar endo.
Awesome. And then again, guys, the specialty endo and our oral surgeons, that's in-house. So you're referring in-house, all that is production that stays in-house. If there are cases that you need to refer out, I'm sure you guys have built some great relationships with offices around you for other referrals. But for the endo and oral surgery, that's in-house, and that's all part of that production that you do get kind of a slice of. So keep that in mind. Okay, so one other question that's popped up. If I start as an associate, how quickly can I become a managing clinical director or a lead dentist with Aspen? Dr. Vile, I'll have you answer that since you recently got promoted.
It depends on when there's an opportunity. Mine, I feel like, was way quicker than normal. Everyone in my area who was hired with me as an associate quickly got moved to MCD during Corona. A lot of docs didn't want to stay. Some people were on maternity leave and didn't want to come back. So they move people around as it's needed. There's usually an opportunity. You just need to be willing to go there if you're willing, and if you want to wait and stay where you are, then wait and stay where you are. I don't recommend buying a house your first year because you might have a great opportunity that you want to go to, be stuck selling your house. But if you're open to it, there is opportunity around 100%. You just have to prove that you have a good attitude, are hardworking, not lazy, and not rude to your employees, and you can move up pretty quick.
Awesome. And then Dr. Smith, you said that you kind of jumped into that MCD role for a little bit, right? While your doctor was on maternity leave?
Yeah, so, I guess I can kind of explain, the difference between that MCD and associate. Typically the associate role, your really only job is to kind of, show up to work and, make sure you do your work. But as an MCD, you not only have to do that, but you're the main factor in terms of driving the office forward. So, just keep that in mind. At this point, you are the leader of the practice. So, anything that's happening is coming to you. Even dealing with a few, insurance issues, staffing issues. It's sort of in one way, shape, or form comes through you. So there's a lot more responsibility there. But my particular situation, it happened right around March. My MCD was going on maternity leave and they left early because of coronavirus. So I took over the office in March and, she decided to come back to work. So, this past September 1st, I kind of transitioned back to where I was. But yeah, basically from March to, September, I've been, kind of leading the office. And it's just been a great experience. So kind of like Dr. Vi said, you sort of just need to go where the opportunity is. This opportunity came up briefly, but, they were very good at, kind of letting me know that it might not be a permanent situation, and that's fine for now. But if I want to go ahead and move to get an MCD position, I could do that, or, just wait until something comes up in this particular area.
Awesome. So you got a taste of that position and now you kind of have an idea of what that role looks like. So if you
Yeah.
decided that was something you wanted to do, you can possibly transfer to an office that has an opportunity for an MCD.
Yes.
Awesome. Okay, cool. So question for you, Ryan. Well, the question popped up again about how we get paid. We've kind of just discussed that. But do we offer full benefits and what does the benefit package look like? So can you talk to us a little bit about benefits?
I can. So we do. So all of our employees, you'll have health, vision. Your dental will be through Aspen. So if you have a family, it would be like they would go into an Aspen office. 10 paid vacation days, 6 paid holidays. There's a 401k match of 4%. So you're a W-2 employee. And so our benefits, I'm on the same exact package as our doctors. So, I mean, there's a small amount you pay per pay period for your portion of the benefits, but the benefits are there. And having paid time off too, especially like not many private practices will pay for time off. That's a big thing to have. I mean, that's 10 days of the year that you're getting your whatever your daily rate is. And then the same with those holidays too. So I think that's a big piece that we have, that people can definitely feel comfortable with, knowing that they're going to have their insurance, and on top of it, having a 401k match is great too.
So this is a good question, guys. How do you feel about the stigma associated with working with a DSO/corporate? What would you say to a student that says he would never work for corporate dentistry? Did either of you guys ever have that stigma when you're in dental school, that like I would never work for a DSO, or you thought what a DSO was something very different from the experience you currently have now?
I feel like in dental school, it's pushed to work for a private practice. Like DSO is really bad. They'll crack their whip at you. Just shadow and see. Shadow private practice, like shadow Dr. Larry or somebody. Then shadow Aspen, shadow Matt or Dr. Smith. And see the difference. See how much calmer it is. It's a stigma for a bad reason. What I at first was like, oh no, everyone says DSO is bad, don't do it. And then I shadowed absolutely everybody. And I was like, I am not working for private practice. There is no way. So just shadow everybody. You can really only determine for yourself. I have friends who just got out of residency and they swear by private practice and they hate DSO. They've never shadowed, but they feel like that's right for them too. So whatever's right for you, but just be fully informed before you form an opinion.
Love that. Dr. Smith, what was your opinion while you were in dental school?
Oh yeah, so I was looking up everything. They probably know about like Student Doctor Network. So I was, kind of like Googling, well, what do people think about Aspen? And one of the comments was like, oh, they would hire a dentist with one arm. And to be looking for solid people, people who know what they're doing, but also people who are teachable. And like Dr. Rice said, you just need to try it and see for yourself. It's not something that I'm going to say is right for everyone. But if you feel like, you want to jump in and give it a try, they're more than willing, and they will support you through that process. It is very different than private practice. A lot of the times, we talk to people, we have classmates who are like, well, private practice owner doesn't want to pay them. Well, I mean, they're the owner. So, technically, it's just different. And so with Aspen, it's individually owned, but you still have that corporate backing behind you. And it's so strong that really nothing could break it unless you were just committing malpractice every day or something like that. So, the sense of security, I feel, outweighs anything. I mean, for me, it's been a phenomenal experience.
That's awesome. I mean, let's be real. I feel like Dr. Vi, you touched on that, where a lot of our dental schools do push private practice, right? Because a lot of the professors and a lot of the clinicians come from private practice. It's what they know. It's, it was their backbone, and they kind of think that the DSO model is the devil per se. But I would agree with you, Dr. Vi, shadow as much as you can. If you are interested in shadowing any of our offices, Ryan can help set that up. I can help set that up. We are very transparent. We want you guys to come in and we open arms, open doors, take a look at how we treat our patients, come and hang out with Dr. Smith for the day or Dr. Vi for the day, and really gauge the difference, and do that with every single DSO if you have the opportunity, or with different private practices. The last DSO I worked for didn't allow shadows. They were very much like, we're too busy, we don't have time, we don't do this. And I'm like, how are the students going to get to understand what we do, right? So I'm all for, please go shadow a doctor, spend some time in an office, ask all those questions that you have, because what you hear and what you learn is very different from the actual experience that our doctors are having. Do you agree?
Dr. Smith, I think you had someone come in and shadow, what, like a week and a half ago, 2 weeks ago?
Yeah, it was one of the D4 students, the Green Scrubs, and she had a phenomenal experience because, to be honest, there are some shortcomings when you're in dental school. There are things that, depending on what clinic team you're on, you guys know who are sitting here listening. What your deficiencies are. This teacher didn't teach me how to treatment plan or whatever. So, I've really tried to take the time to, show anyone who comes in what that looks like and to kind of steer you in the right direction when you go back to dental school to make sure that you are prepared when you come out, because, you kind of don't know what you don't know until all of a sudden you're like, oh crap, I really don't know that. And you're sitting in front of a patient having to explain something. So if you can kind of get a heads up about, what things to be looking out for and paying attention to by shadowing in the office, then let's do it. And I love teaching. Some of the staff thinks it's a little nerdy sometimes because, I'll spend all day telling them, oh, did you see this and this? And, the assistant's like, okay, Dr. Smith, time to keep going. But this is where you learn. And it's like someone only has to show it to you one time and it'll stick with you forever.
Awesome. Now we have a couple COVID questions that popped up. Obviously COVID has impacted dentistry and impacted, the world drastically. So talk to us a little bit about your current situation in your office, guys. One of the question is, how has COVID impacted dentistry for you specifically? Are you guys doing teledentistry at work? And what are some of the policies that are in place? Doctor, has COVID impacted, work specifically?
You said me, right? Your video cut out. So,
I'm sorry. Yes, Dr. Guy.
So I moved to Greenville because of COVID. The other doctor didn't want to stay. He was close to retiring anyway. It opened up. I went in there. We were limited at first on what we would do, but with Aspen, they kept the PPE coming. Like yesterday, my assistant opened the box and they're like, why are they still sending this stuff? We have plenty. So it's like Aspen is a big enough network, they can keep the PPE coming. All the policies and laws, as they change, Aspen updates us. I don't have to keep track of, okay, well, this is legal today, but this isn't legal tomorrow, stuff like that. They'll keep us informed. We've had limited staff. They're always telling us like the new laws, so no more than 2 people in the break room, stuff like that. It's just, I feel like I don't have to think about anything. I just need to pay attention, use my PPE that keeps getting sent to me, and everything is fine. We have pre-screening for the patients. If like we have ways, like the patient calls in and said, oh, I had to get tested, we have that documented. We don't have them come back for a couple weeks. Aspen supports us on that. It's just, I feel like we're very well taken care of with the COVID aspect. If somebody gets sick at work, there's time off. I haven't had that happen, thankfully. Everyone's been really good about their PPE. And my front office staff stops patients if their temperature is too high. So it's really good. I feel safe.
Good. Dr. Smith, are you having a pretty good experience with the COVID situation? Do you feel safe and feel like Aspen's providing enough, policies and procedures in place?
Yeah, so same thing with Dr. Vi. My office actually closed because I was, full-time in Nashville. So we ended up closing for about a month. But when we came back, Aspen had a very structured plan in terms of, which offices were coming back, full steam. They also had some doctors doing teledentistry. But also during that time, they've also offered, pretty much unlimited CE opportunities. So, we were also able to start virtual implant training that actually was supposed to be in person, but it got canceled. But in terms of COVID, just like Dr. Vi said, there's daily screening questions, there's temperature checks of both the patients and the staff. You know, right now, 2 of my assistants are going to be giving birth soon. So definitely for them, that was, you know, COVID is very high on their list. So, you know, we do try to make sure that no matter what patient comes through the door, that they are comfortable. Because I can have a different level of comfort than they are, but, you know, we all have to see the patients and we're all a team. So, you know, if it comes down to it, then they'll get rescheduled or, you know, something like that. So, you know, we don't push anything on anyone just because, you know, necessarily just because of what I want. And to go off of the PPE thing, you know, Aspen is such a large corporation with 800 plus offices. We have a huge monopoly on PPE. It's astronomical. We have tons and tons of boxes of masks, and it's almost like overflowing how much stuff we keep getting. And we actually don't even have. It's like we have so much we can't even use it all, to be honest. That's how much we have. So. And then like Dr. Vi was saying as well, there's also different guidelines they've put in place. So depending upon, you know, the type of procedure we're doing, you know, if it produces no aerosol, then, you know, hey, you know, we can just wear XYZ. But, you know, if I'm doing a surgical extraction, I'm going to have on, you know, my gown, my N95, my face shield, my hairnet. So, you know, we can be decked, you know, however it is we need to be.
Awesome. So you feel, I mean, everyone feels safe. And I just went and got a teeth cleaning not too long ago, and I was just completely blown away at the procedures that were in place. You know, and I'm like, I work for Aspen, and they're like, we don't care. You have to stay outside. We have to take your temperature. You have to fill out this form, you know, and I'm like, that feels good because, you know, we want to make sure that everyone that's working in the offices are safe. All right, guys, we have, time for one last question. We didn't get to get through all of them. So if there's any questions, guys, that we missed that you definitely want answered, please don't hesitate to reach out. I know that we touched on CE a little bit. The question that populated was, can you choose which CE courses to take, such as implants or sleep apnea? Does Aspen pay for all your CE courses, or how much do you get allotted for CE? Ryan, do you want to answer that really quick? What's our CE situation?
Dr. Vi, you looked like you had something to say too.
Yeah. All you guys can jump in.
But there's a website you go on to, and it has more CE than you can do in your lifetime. You just search for a topic, you do it. There's some live classes. There's some live, like, scheduled classes that they have you do, like the implant one. There's some that have homework, like the endodontist or the root canal class. If you want CE, you're not gonna be short on CE.
It is paid for as well, so you're not having to come out of pocket for CE. If there's like the only situation I ever say is if you're like, there's a super specific class you want to take and it's in person and maybe it's in another state, you know, that situation might be a one-off. But if like you just want good quality CE and options, like you will not come out of pocket whatsoever for CE at Aspen.
Absolutely. So guys, we have an abundance of CE courses, just like our doctor said. We're actually offering CE courses for free for any of our students, for any dental professionals. It is free through March of 2020. And this came out during COVID to kind of keep you guys busy and engaged. I'll shoot all the attendees an email with that link. It is free. Take advantage. They're certified. And like Dr. Vi said, there's thousands of CE courses on there. But that's our time, guys. I want to say thank you guys for our 2 doctors that jumped on and were able to answer some questions. We really appreciate you guys. And to our attendees, if there's anything we didn't get a chance to answer, please don't hesitate to reach out to me directly or to Ryan. I'll shoot you guys an email with my information, with Ryan's information, and I'll send you guys that link for the free CE because that is available until March. But again, thank you guys so much for being on. Dr. Smith and Dr. Vi, you rock. And I hope you guys have a great night. And I will be harassing you soon to do another one of these with me.
All right, awesome.
Thank you, guys.
All right, guys. Thank you so much, Ryan. You guys have a great night. Students, be well. Good night.
Bye, guys.
Bye.